We felt like it was a moral obligation on our part to give students the knowledge and skills to be able to combat opioid overdose deaths and substance misuse in general in the state of Rhode Island.
I think it was very clear to us as medical educators that we had a responsibility to respond to the opioid epidemic.
For us, at least, we created a new model, a new pathway to being data waiver trained. And so up until we did what we did, the only way to really get data waiver trained was to go through the 8-hour curriculum. So we designed the curriculum to be longitudinal. And the reason for that is that we wanted to deliver developmentally appropriate curriculum at each stage of the student's training.
So starting from the first year, they learn everything from how opioids work and the receptors and the biochemical transmitters of the brain, as well as things like motivational interviewing and how to screen and counsel patients.
It gives them a lot of experiential learning, not just on substance use disorders, but also working on interprofessional teams to address the needs. They work on a complex patient case that has introduced all sorts of medical, social, and social work and nursing issues that they can work together to address. And then they actually work with a standardized patient in a simulated setting.
The unique aspects of the curriculum is in their 4th year, by the end when they graduate, they've learned enough to get a data waiver, which would allow them to prescribe buprenorphine once they've been fully licensed.
And our model was actually used nationally in a bill that was passed by both the U.S. House of Representatives and the Senate back in October of 2018, where this will now be a path for all medical schools to take. We're trying to expand access to medication-assisted treatment through our initiative, and we're also trying to destigmatize patients who suffer from opioid misuse.
So we hope we're training empathetic physicians who can recognize substance use disorders, who can feel comfortable screening for them and talking to the patient about them in a way that helps our patients feel comfortable looking for help and reaching out and seeking treatment.
If we can train an entire workforce that are willing and able, I think it will have a huge impact, and I think it will mean a lot on an individual level, but not to just those affected, for their families, for communities, I think nationwide.